Hi viewers, welcome back. In today's video, we are going to start management. Okay, management of nursing service and education. So many students they have asked for management classes, and today we are starting with management. Okay, so what is management? So management, you don't have management as a separate content. You have management, administration, nursing research. These are all like coordinated content. Okay, so when we come to management, we always have administration and management topics together. Okay, so when we are dealing with this management, we will be talking about administration also in between. So your administration and the management will be from both the sides, that is from the educational side as well as from the organizational side. Okay, so both sides you will have this management and administration classes. Okay, so today we'll just start an introduction. Okay, so what is management? Management is managing, that is like you are taking the sole responsibility of managing an organization, a department or a function. Okay, so management is your overall management of the process of doing things. Okay, so now first is your concept of management. So when we come to the concept of management, what is all inside the management? So when we come management, we have 4 P's. Okay, so we are worried about these 4 P's when we come into management. Okay, so first P is productivity. When we come or like when we deal or think about management, it is always the production area. So how do you work effectively in production? That is like benefiting the administration department. Okay, so that is like you are going to increase the productivity, that is like you are working for the organization to improve the quality, improve the productivity of the organization. Then we have the people. We are going to think about the people because we are going to deal with the people. So that is like when we have a management process, we will have the real life members, that is like we have human beings who are going to increase the productivity or the profit for the society. Okay, so we are going to deal about the people. So your second P is your people, and then comes the profit. Okay, so our basic aim of management is profit. Okay, so when you run a nursing institution or otherwise when you run a hospital or any type of organization, it is your profit matters. Okay, so now whatever it is, when you want to improve the quality also, the profit is going to increase. Okay, so your people working for the productivity, they are going to increase the profit of the organization. Just imagine you have hundreds of hospitals, but why specifically you have the brand name of Apollo? It is because of the nursing quality. You have the quality care provided in Apollo. So that is the reason why you are getting the name of Apollo. So that is like I am telling, just I am not an brand ambassador for Apollo, but I am telling it is because of the quality when you are providing. So this quality is giving you more profit. So however they tell you it is 8 lakhs or 10 lakhs like for the surgery, you go to Apollo, it is because of the brand, it is because of the quality you go, and so their profit is also improving just because of the productivity or the quality. And then finally we have public responsibility. Okay, so not only it is the productivity, I said no, it is because of the quality, it is because of the public relationship. That is, you are in the way how they communicate with the patients, how they approach the patient, how they explain the things to the patient. Okay, so what is the difference between a government organization and a private organization? In a government hospital, just imagine you have a cancer patient. Okay, so you are going to give chemotherapy for this patient. Okay, when you go to a government setup, okay, what they do, the same chemo drugs what we are doing here also they are going to provide there, but the doctor doesn't explain great lot of things. They are not going to sit and talk with you because they are very busy. So they will have a minimal explanation, they do things fast they have to do, they have to attend the next patient. So nurses are also like that, 50 patients, 100 patients under control. So for all these patients they have to give chemo drugs. So they don't have sit and explain to the patient. But what happens in a private organization? It is the one-to-one relationship. As because they are providing salary, they will have lot of money. So what happens? They can hire many nurses. You will get lot of nurses. So what happens? Like you can have one-to-one communication. So explanation of procedures can be done. So slowly you will your public relationship is going to increase when you are doing your quality services. Okay, so these are the 4 P's where we are going to have a great concern when you come to management. So your productivity, people, profit and the public responsibility. So these are the 4 P's we are worried in management. Only management stands because of these 4 P's. And then we have the process of management. So when we come to the process of management, again we have 4 areas. So your first area is planning. Okay, so planning. So when you come to the managerial level, the manager takes the sole responsibility of planning. Okay, so the manager has to plan. Manager in the sense, it is like the higher level, the top level managerial people. Okay, so they are going to plan what is they are supposed to provide, what type of care they have to provide, who is going to provide. It is the registered nurse or the registered midwife or the doctors or the junior doctors, the seniors, like they are going to plan what is to be provided to the patients. Okay, so the planning is done. And then is the organization. So organization is step by step process. So first this is to be done, then the next step, then the next step. It is like planning whether whatever they have planned, it is going according to the process they have to do. So that is your organization. And then is actuating. Actuating is your directing. Okay, you go do this work, you go do this work. So you are allotting job responsibility, so what they are supposed to do. So that actuating, you're directing what they are supposed to do, who is supposed to do this work, how long it has to be done, what is the result, what are the expected results. All these things you are going to do with this actuating process. And then we have controlling. Controlling is like during the process, that is like during the course of time when the work is being done, there is no deviation. So that is like when you are given a task, that task has to be completed, and once the task is finished, and then only they can go on to the next task. Okay, so your controlling process, the deviation must not be present. So that controlling or the target oriented process is called as your controlling area. So you have your 4 areas: planning, organization, actuating and controlling. Okay, so these are the 4 things. When you come to the management area, we are worried about these 4 people and the 4 steps when we are doing your management process. Okay, so in next class we will talk about something little more deeper about management. Till then, take care.